Greetings. Let us learn about oropharyngeal dysphagia. So, after chewing food, when we try to swallow, we want the food bolus to go down the back of the tongue into the pharynx and then enter the esophagus. In the process, it should avoid going up into the nose or into the windpipe or trachea. So this involves a very careful coordination of different muscles working together and the nerves that play the right tunes to allow this swallowing to happen. And when this is disturbed, it results in oropharyngeal dysphagia. And this is very easy to recognize by just listening to the patient's story. This is seen in patients like this one, an 80-year-old man. He suffered from a stroke recently and started having trouble swallowing. And even saliva was causing trouble to him. Whenever he tried to swallow saliva, he coughed and choked on it. And if you give him water, he will choke on it as well. You should avoid that when you hear this story. And this is a typical example of oropharyngeal dysphagia. A same problem could be seen in patients who have problems with their nerves or their muscles. And an example for problems with the nerves is motor neuron disease, and problem with the muscles is one of the different forms of myopathies. So these patients, endoscopists can make the diagnosis by listening to the story, and what they can offer is to provide nutritional support and avoid the risk of aspiration by asking these patients not to take anything by mouth, but instead deliver the nutrition into either the stomach or into the small intestine. And when it comes to that, you go to the nutritional support section of your accessories and pick up a nasojejunal or nasogastric feeding tube and place it down either into the stomach or into the small intestine. And it involves passing a tube down the nose through the pharynx, esophagus, and leave it in the stomach, or you could pass it down into the small intestine. Usually nasojejunal feeding tubes work for a few days or weeks, and longer term can cause problems. Longer term use of these tubes could cause problems and a lot of discomfort to these patients. When somebody needs longer term support, you go with percutaneous endoscopic gastrostomy tube, otherwise known as PEG tube. And this tube, instead of going down the nose and leaving it in the stomach, we make an opening into the stomach and leave the tube directly into the stomach, bypassing the nose and throat and esophagus. And this is how it looks. The tube has gone from the abdomen directly into the stomach. That is a PEG tube. We will learn in a lot more detail about how to place these tubes in a different section. I would like to thank the support of Dr. John Stroline, Mr. Charles Butt and HEB, and illustrator Miss Angela Deal. Thank you.